So we're in an interesting time. The Chinese have an old saying, it's a curse to live in interesting times. And so maybe it is a curse. Um, we're working very hard in the hospital. The only people in there, of course, are the essential folks, the caregivers, myself, the nurses, the technicians, and most of the administrative people are working from home. It's a little strange walking down the hall, that's totally empty instead of tons of people walking back and forth. The patient visitors are not allowed in because of the public health implications of coming into the hospital. So it is a very, very strange time. But having been a young person in the 60s, and I remember Joan Baez singing, "We shall overcome." And I keep thinking that we shall overcome. We will defeat this thing. It's just going to take time. And I recently finished Eric Larson's book on Churchill's dealings for the year of the Blitz, the main Blitz of England when the Nazis were bombing every night, destroying English cities. And he gave his wonderful, we will never give up speech. And I believe the same thing. We will never give up. We're going to beat this thing, but we're going to take damage in doing it, just as the English took horrendous damage during the year of the Blitz, where the Nazis bombed England every single night. So all I can say to folks is keep reading the reliable sources on the internet. There's a number of excellent medical websites. A number of institutions like the American Cancer Society, American Heart Association, American College of Cardiology, the American College of Physicians, all have excellent COVID information, professional COVID information. And again, you can stay tuned into this way ahead of what comes out in the literature, just because it takes us time to publish it in the literature, but it comes on the internet, the same day. So stay tuned, and please stay safe, use masks, social distancing. Don't go to any COVID parties. We've already seen that the COVID parties result in many people getting COVID. And don't go to large group or meetings and so forth where there's bound to be some people who are shedding the virus. We know now that for the first 3 to 5 days of the infection, you're shedding the virus, but you have no symptoms. So you're particularly dangerous, and you can't know that you have the virus at that time. So hope everybody stays safe and keeps reading the American Journal of Medicine. And I keep telling people in a year's time, I want to publish a beautiful long review article that takes us through the whole history of the pandemic, the pathophysiology, the diagnosis, the complications, and the treatment. I think by a year from now, we should have a lot of that information.